Understanding how consumers consume really begins to help us out a little bit here. From an interest, from the perspective of a consumer, they have an interest, they learn, they evaluate, they justify, and they purchase. And in the red there, you can see kind of how they move down this process of their search, their identification, evaluating their needs, and so on. And they ask a whole series of questions. How we overlay our communications on top of this is critical, again, to their specific point of view. They're not looking at it from an acquisition and a retention and an engagement and a post-discharge communication this and a nurse navigation reminder that. They're looking at it from a perspective that they have certain needs that they need to have satisfied. They need to have certain solutions brought to the table. And if different groups and different departments are sending different messages at different times, this is where the poor patient experience really begins to kick in. From a marketer's perspective, which is what the line of sight we're trying to focus on here, we're beginning to slowly make the case that marketing should have a greater ownership over post-clinical and post-outcome type communications, not just preclinical. We're beginning to build the case here a little bit, very slowly but surely, because marketing has the best chance at communicating the proper way because it's marketing, and that's what their job is. Next one, Chris, please. Just a quick example of a bariatric nurturing program, just to kind of give you an idea of what some of those communications look like. In the realm of a bariatric campaign. So this is now a campaign where we've acquired a consistent number of patients, and we're now nurturing them over an extended period of time in a retention basis to try to get them to convert clinically. Maybe these become slowly clinical-based communication programs in a post-clinical environment or a post-discharge environment. And what we'll see here in a later example is that the key is that a consistent template, a consistent design, a consistent approach, but a changing message is what's critical. We don't want one communication coming from a marketing engine and then another communication coming from your EMR. Everything looks different. Again, the patient experience begins to break down.